Yes.
Del miércoles 22 de abril de 2020.
Right, it is the Wednesday, April
Y vamos a iniciar la conferencia
22,
de prensa diaria sobre la
and we'll
situación
begin the
de
daily
COVID,
press
la
conference
pandemia de COVID,
regarding
la enfermedad
the
causada por el
COVID
nuevo coronavirus
pandemic, which is the disease caused by
SARS-CoV-2.
the new coronavirus
Hoy vamos a
SARS-CoV-2.
atender
Today we
tres
will
temas:
be talking
el
about three
informe
topics:
técnico diario,
the daily technical report,
en primer lugar; en
the
segundo
first
lugar,
place; in the second
la
place,
doctora Alessia de la Torre,
Dr. Alessa de la
quien es
Torre,
la directora general
who is
del
the
Centro
General
Nacional
Director
para la
of the
Prevención y
National
Control
Center
del
for the Prevention and
VIH-Sida.
Control of HIV,
Nos va a hablar de un tema que
AIDS.
ella coordinó
She will
en la
be
esfera
talking
técnica
to us about
y que es
a
de extremada
subject
importancia
that she was in charge
no
of
perder de
coordinating
vista
and
y
that is
tomarlo en
very
cuenta como parte de la
important
preparación
for us
técnica,
to know.
y sobre el que se ha comentado aquí. Ha habido
And it is a subject that we
preguntas
have
y
commented
por eso
on
queremos
before, and there
presentarlo de
have been
manera
several
explícita.
questions,
Y es
so
el
we
asunto
wanted
de
to
qué
make a more
va a
explicit
ocurrir
presentation. And
si
this
tenemos
subject
un número
is
importante de
what
decesos
is going to happen
y
if
las
we have
previsiones
an
que
important
se tienen
number
que
of
tomar desde el punto de vista
deaths,
técnico,
and what are
pero
the
también,
provisions that have to be
independientemente del
adopted
número,
from the
cuáles
technical
son las condiciones
side
de
of things,
bioseguridad
but also what are
necesarias
the
para atender este
biosecurity
tipo de
conditions that
situaciones
are
todos los
necessary
días.
to
La
handle
doctora
these
Alessia de la Torre,
situations every day.
independientemente de que es la directora
Dr. Alessa,
del CENSIDA, es una
independent
especialista en
of her
enfermedades
position as
infecciosas, ella es
director of
médico
the
internista, es
HIV
infectóloga
National
y además
Institute,
es maestra
she's
en salud
also
pública, y por esa razón
she also has a
está al
master's
frente
in
de la
public health.
coordinación
She has
de
held
este
several
empeño
different
en la
public
prevención
offices,
particular. Muchas
and
gracias,
she's in
doctora
charge of
Alessia.
this specific
Y
subject.
el doctor Ricardo Cortés
And Dr.
nos va a
Ricardo
informar
Cortés will
sobre
be
algo que ayer preguntaba
continuing
un colega periodista,
uh,
un
following
reportero,
on
que
a
es cuáles son los elementos de
question that was
comunicación al
posed by
público,
a
de
journalist
asesoría al
yesterday,
público,
which was
que
related
están
to
disponibles.
what are the different
Ayer
elements
presentó
of
el propio doctor
institutional
Cortés
communication
la
that are
nueva
available to the
aplicación
public.
de
Yesterday, Dr.
diálogo y
Cortés
de
presented the
asesoría a
new
través de
app,
Susana a distancia,
the new chatbot
y esto no es
of
lo único. Hay un repertorio muy
orientation
amplio que está desde hace varias semanas,
of
entonces hoy va a
information that is
recapitular el
now
doctor
available
Cortés
through the
sobre
WhatsApp
lo
of
que está
Susana Safe
disponible
Distance,
para uso del
and
público
he
que
will be
pueda
talking
asesorarse
about
en lo que
this again
corresponde
and
hacer en
all the
materia de
other options that are
prevención y
available to the
atención
public
en todo momento.
in
Bienvenido,
terms of
doctor Ricardo Cortés, director
information,
general de
orientation.
promoción de la salud.
So,
Empecemos
welcome,
entonces.
Dr.
Yo
Cortés.
voy a presentar
Let's
la
begin
parte
then.
técnica
I'm gonna be the
y
one in charge of presenting the
enseguida
technical
les doy
report
palabra a
today,
mis colegas.
and then my colleagues will have the floor.
Como es costumbre, vamos a empezar con el panorama internacional,
As
que
we
se
usually
resume
do,
en
let's
esta
begin with the
gráfica de barras
international
que
landscape,
nos
which is
muestra cuál es la
summarized through
distribución
this
por
chart.
regiones del mundo o
Here we can
continentes,
see the
gruesamente
distribution per region
en
all over the
términos de
world.
la contribución
And
de
basically
casos
what we are
nuevos.
looking at
Recuerden
is the
que el
contribution
enfoque que tenemos ahora a partir de la
in
fase 3
as
es los casos
measured in
nuevos,
new
la
cases.
actividad
What we're
de
looking
la
at
epidemia
are the new
y
cases
todo lo demás que
that
solíamos
give us
presentar.
an
De
idea of the
todos modos, está
activity of the
disponible la
pandemic
información pública
worldwide.
en el
And
micrositio.
all of the other
Aquí lo que
data that we
tenemos es
were
que la
presenting
región de
before
América,
is
tal como lo
available
habíamos
at the official
previsto,
website. Let's not
está
forget that.
ya en
But
mayor
what we can
actividad
see here is
respecto a la
that the
región europea.
Americas
Esto es buena
are
noticia para
showing
Europa, no
greater
necesariamente buena
activity
noticia
than the
para América.
European region. This is
Háganme
good
que
news to
nosotros
Europe, not
estamos
necessarily
gruesamente
good
entre
news
un
for
mes
us,
y mes y medio
because we
en el
have a
continente
delay
americano, más tarde en la
of
epidemia
a
respecto a
month,
Europa.
between
Entonces
a month
Europa
and
ya
a
va
month and a half,
en
as compared
decrecimiento
to
de su
Europe.
epidemia,
So
mientras
Europe,
que
the
nosotros vamos
European
en
region is
ascenso.
coming out of the pandemic, is
45% de los
going
casos
down on the curve,
confirmados
but we are going up still. We're entering the most intense phase of the pandemic. So here we have the specific numbers on the screen. Here we have the cases that are active that developed symptoms during the past 14 days. And this percentage has been going down, has been decreasing. And that is because the pandemic is decreasing in the European region. So that's why the global average is going down. But as the Americas enter the most intense phase, the global average will probably go up again. Here we have, and we have calculated from the very beginning of the pandemic in Mexico, we have accumulated a total number of 10,544 confirmed cases. This is the cumulative confirmed cases that we are referring to. But out of these cases, out of these overall total cases, there are only 3,618 active confirmed cases. The rest are, most of the rest of the cases have recovered, and a small percentage have unfortunately died as a consequence of the COVID disease. Most of them because they had a pre-existing chronic condition, or sometimes they belong to older age groups, and a small minority were pregnant women, unfortunately. Here we can look at the distribution of the active confirmed cases nationwide per state. This is how, by visualizing this map, we can have more clarity of the variation that exists among the national territory in terms of the pandemic. So as we know, we have the highest activity of the pandemic is concentrated around the Mexico City and the State of Mexico area, which is known as the Mexico Valley area. And also we have important activity in Baja California, in Sinaloa, and in Quintana Roo. If we look at the same information in the form of a bar graph, we can have a more pristine comparison between the total number of cases in Mexico City, Mexico State, Baja California, and those three being the leading ones, and then the rest of the states of the country. Here we have the cumulative incidence. This is the active case incidence. Remember, the incidence is calculated taking into account the population of each state. So we can have a more precise comparison between them because we are taking into account the population of each one of them. We cannot compare the total numbers of two states because they have different populations. But if we do the calculation and then we have the incidence rate as a result, then we can have a more precise comparison. And this is what is being shown here. The active case incidence rate. This is the same data, but now in the form of a bar graph, so we can have a more efficient comparison. The leading entity is the Mexico City, Mexico Valley area, then you have Tabasco, and then the rest of the states. When we see the developing of these active cases during these past 14 days, we can see how the development is also related to the number of people who are recovering every day from this disease. Here we have the information regarding the death toll, these unfortunate deaths that have occurred, and the data is very revealing in terms of something that we have been stating over and over, and we will continue to emphasize, and that is that in comparison with other countries, especially European countries, that are on average older than us, meaning that they have an older population on average than the Mexican population, we would present an advantage in that front because we have a younger people. But we have an enormous prevalence of pre-existing conditions such as obesity, diabetes, hypertension, and a long list of conditions and diseases that are directly related with bad nutrition, and that means that even though our population is younger, a big portion of it still is at a higher risk of having a fatal outcome. So do not, let me be very clear about this. Nobody is out of risk. Nobody is not subject to being potentially infected with COVID. We can all get infected with COVID. We have explained before the mechanism of transmission is through saliva, through sneezing, coughing, basically through being close to each other, to other people who might be infected. But even though we could all get infected, in particular the people who are the pregnant women, the people over 60, the people who have some sort of immunosuppression, the people who have obesity, hypertension, diabetes, kidney failure, pulmonary disease, all of these people, it doesn't matter whether they have it doesn't matter whether they belong to a vulnerable age group, and maybe they don't even know they have these pre-existing conditions. So if any person, doesn't matter whether they have a condition or not, a diagnosed condition or not, whether they belong to a vulnerable group or not, if they exhibit shortness of breath, meaning respiratory insufficiency, and this means they have trouble breathing, they find it very difficult, and this is an alarm sign. This is a technical term. This is an alarm sign, and this alarm sign should lead this person to go immediately in the search of medical treatment. Treat this as an emergency. So when we take a look at these deaths, it is important to restate that the surveillance mechanisms that we use have a confirmation time. So when we test the patients, there is a confirmation period in which we are waiting for the results, and those cases are cataloged as suspect cases in the meantime. But this data can take a little bit to stabilize. And specifically in the cases in which the people unfortunately die before the results coming out, we have to wait. But even in those cases in which the person dies before being tested, we have a protocol that states that then a clinical diagnosis can be considered as proof of confirmation for COVID. So if this person died, unfortunately, before they could get tested, but they had contact with people who were infected with COVID, or present clinical evidence that they were most likely a COVID-infected patient, then the medical committee that will determine the status of this patient, of this deceased patient, can incorporate into the Function Act this patient as a COVID positive patient, even though there is no test. And I am going into detail on this because there has been information circulating in the media regarding that this could be a way of under-reporting some of the COVID-related deaths, and this is completely false. Even in the very rare situation in which there is no test for these patients who die prematurely, there is a mechanism for diagnosing and stating that they were COVID-19 related deaths. Here we have some information that talks to us about the relation between the status, the clinical status in which the patients who arrive at the hospital are at the moment of their admission. And the important thing to emphasize about this is that all of those people, every single people who is exhibiting some alarm signs, can communicate to the numbers that we have provided to the population to seek for medical orientation. They can also call the emergency number, the 911 number. If they are in an emergency, they can call because they have been oriented to provide orientation regarding COVID-19. And now you can also contact Susana Safe Distance through WhatsApp. And these are only some of the means of communication that are available for the public. Here we have the positive result rate, or the positivity rate, which is basically out of all those people who are tested because they are considered suspect cases, how many of them, what percentage actually turn out to be positive for COVID-19? Here we have the development of this positivity rate since we started reporting it, and we will continue to report it because at the very last phases of this first cycle of the pandemic in our country, we will have an increase in the number of people who have the virus as compared to those people who present the symptoms. And as we move forward through the year, and then we get closer to the winter in Mexico, then we will have more and more cases of influenza, that is a natural phenomenon, and we will see the positivity rates for influenza go up while the COVID-19 positivity rates go down. Finally, we have this chart that shows the confirmation process in those patients that are still alive, those people who have are in severe condition and also in non-severe condition. And we can see how this confirmation process is moving forward, and this red area will be occupying the space of the yellow bars. Last but not least, we have the epidemic curve. This is the cumulative number of cases that we've had so far, and on the orange bars we have the newly confirmed cases every day. So far we have 10,544 cases, confirmed cases. Dr. Alessa, now you have the floor. Today we thought it was incredibly relevant to talk about a subject that can generate concern, even anguish amongst the population. This has to do with the fatalities of this pandemic. So we have updated the guidelines for the management, for the handling of dead bodies in this specific context. The most important aspect of it, and the key message that we want to deliver, is that these guidelines allow us to implement strategies to take care of the health of the population. There are three pillars. The first pillar, and this is something we have to make sure happens every day, is the dignified treatment and the humane dealing with the relatives of the people who has died, of the patient who has died. This process of presenting an ever increasing number of fatalities can affect all the actors involved in many dimensions. On the humane dimension, on the human dimension, but also on the technical and logistical dimension within the hospital. And it is important to have clear guidelines as to how to deal with these situations. And in those institutions in which they have specialized teams to deal with losses, they must come into play as well. And it is important to make our best to prevent any discrimination behaviors from taking place throughout this process. This is something we have to reinforce as a society, as a whole. It is important to have compassion, it is important to have empathy, and to understand that these relatives are going through a difficult process of losing someone that was very important in their lives. So this is the human side of things. The second pillar has to do with the biosecurity measures. And the biosecurity measures are aimed at preventing new infections and new contagions from happening. And they are meant to cover both the medical practitioners that are involved in the situation and also the community, including the dead patients' relatives. To the degree that we are successful in implementing these biosecurity measures, that is the degree to which we will avoid any unwanted contagion from happening throughout this whole process. Each attention unit is currently verifying the capacity and the logistic structure of their morgues, and those actions that and they're implementing the best practices in order to guarantee the fastest and most efficient handling of the dead bodies that can be provided. Again, we want to have at the center the solidarity and the support that must be extended towards the relatives of these patients. Now, this is a subject that also generates a lot of anxiety. Sometimes we see images in the media, on TV, of the personal protection equipment that is being used in the handling of the dead bodies. We want to emphasize that the guidelines regarding this personal protection equipment are based on the recommendations of the World Health Organization, of the Pan American Health Organization, and of other international organizations and institutions that are expert on the matter. Remember, what are the ways in which a person can be infected with SARS-CoV-2? First of all, could be through contact. So this contact can happen directly, body to body, skin to skin, between medical practitioners and the patient, or non-directly, as through some saliva droplets or by other means. For example, in the case of dead bodies, we also have some kinds of droplets that are not necessarily saliva droplets, but they are secretions that are expelled from the body after the death. We also have spray-like secretions that are micro droplets that only happen during certain procedures, and these happen specifically during autopsies. So for these ones, we have very specific biosecurity procedures and guidelines. Now, to come back to the original point, that was to guarantee the biosecurity of those related to the deceased patient, It is very important to limit the numbers in those cases in which access is granted to the relatives to say goodbye to the dead patient. For example, it is important to limit the amount that of relatives that are granted access to see this body. But also it is very important to control all the conditions in which this exposure happens, and this involves personal protection equipment. So as you can see, the main thing is keeping our hands clean, because we're not only worried about the coronavirus, there are also other kinds of germs and microorganisms that can come into play here. So it is very important to guarantee to keep our hands clean at all times by washing them with soap and water. Also, to prevent some other types of contagion, you can use a laboratory coat, you can use surgical gloves, and we can use a mask. Now, these relatives that are granted access to see their relatives, their deceased loved ones, must be surveilled at all times by the medical professionals that will be present at the time and in the place in which this visit happens. Now, we would also like to talk about all these images that are coming to us through the media, that we see all these sprays being used and all these disinfectant and antibacterial products being used to ensure the sanitization of certain surfaces. But really, what is backed by evidence and science is that the most effective way of sanitizing any surface is using soap and water. And basically we have a very simple technique, which is using 3 different buckets. In one bucket we have soap and water, and in this first bucket we can deactivate all these substances and microorganisms that are present in the environment, right? But then also we have to be careful, because soap also deactivates chlorine. So we've heard of people who mix chlorine with soap, with other chemicals, and then by mixing soap and chlorine together, you are deactivating the chlorine. So in that case, you must use only water in order to not to deactivate the chlorine. After that, you have to so first you wash with soap and water, and then you disinfect using a solution of chlorine, but you have to wash the bucket first. Now, the chlorine has to be applied it has to be diluted in water first. You shouldn't apply it directly, because this could have negative consequences. This solution, you only need maybe 30 milliliters of chlorine in 1 liter of water. So we're talking about a 4%, 6% solution, more or less. This is more than enough to act as a disinfectant. And in this way we can guarantee that our surfaces in which in which some person who was a suspect case or a confirmed case came in contact with, we can guarantee that these surfaces are safe and clean by applying these 3 steps. So first, soap and water, then rinse the bucket very, very well to eliminate any residue of soap, then mix some chlorine with water and disinfect with that solution. And that's it. Remember, if the virus is on a surface, It's not gonna grow legs, it's not gonna jump, it's not gonna fly. So it's also not gonna jump from your hands to your body. That only happens when you touch your eyes, your mouth, your nose with your hand, that you actually allow the virus to go into your respiratory system. Now, I would also like to bring your attention to a specific protocol that we have developed that concerns those unidentified bodies that haven't been claimed by anyone yet. And this was a protocol that was designed in close cooperation with the Ministry of the Interior, and it has 3 pillars. First of all, in these specific cases, the cremation of these bodies is prohibited. In second place, it is prohibited to bury these unidentified bodies or identified bodies who haven't been claimed by anyone yet. It is not allowed to bury them yet. And the third pillar is that we need to continue the search for them, for their identity, who they are, where are their loved ones, their family. So then a file must be created so we can continue the search of these people. Thank you. All right, now, Dr. Ricardo Cortés Alcalá, you have the floor now.
Muchas gracias, muy buenas tardes a todas y todos. Ayer comentaba uno de los
One of your colleagues asked us, why did you create this app just now? Why didn't you do it before?
A Susana distancia en el chatbot. Creo que algo que es importante es que
it's important to understand that Susana's safe distance came to life a month ago.
Nació hace un mes y ha tenido múltiples actividades, ha sido adoptada.
Now we are seeing that people have accepted Susana distancia, Susana safe distance, and she's having a good effect on people. People are accepting her. This chatbot is a new way to communicate with people. As Dr. Lopez-Gatell was saying yesterday, we have a cognitive load that is getting really heavy. There's so much information that people are giving us that we don't know how to choose what is the best information or what information is true. So, of course, we were looking into different ways of communicating with people to see what would be the best way to get the information across and talk to them about preventive measures. While we were in phase 1, we kept things really simple. We said, stay at home, wash your hands, and that was the direct, simple information that we were getting across. We were saying, if you're sick, then you should just stay at home. If there's some sort of more serious problem that you're having, then maybe you will need to go to a hospital. You might need to go to a Social Security Institute to get help with that. We were telling people in phase 1 that the virus was going to arrive to Mexico, it was going to come to Mexico, and we were getting them ready for what we were going to be doing when that did happen. When we introduced Susana safe distance, we continued talking about those same elements, but we started to place Susana safe distance in on different social media. We wanted to make sure that people did understand what we were wanting to communicate to them. And we got information from experts here, people who are experts in marketing and social communication. These are people from the Secretariat of Health. We had being spokespeople to get this information and truly have a good idea about how we were going to get those messages across. We wanted to make sure this information was in hospitals and on many other sites. We have a website where people can access information.
de cierta forma, poniendo a disposición de todas y todos la información que creímos en ese momento y intuimos en ese momento más correcta para ir comunicando los riesgos que poco a poco íbamos a estar teniendo. Y después, efectivamente, con el apoyo de Vocería de Presidencia de la República, se convirtió esto en una página específica, en un sitio específico, coronavirus.gov.mx, que además ha ido también transformándose. La sociedad civil, gracias a esto, ahorita tenemos 12 millones de usuarios, 12 millones de personas diferentes que han entrado a ver la información en la página
we've had over 12 million users that have entered our official website, and we've had feedback from the civil society and from people with disability that in a fantastic way have contributed to this common goal of everyone in this country having access to information. The same way, we have translated to different indigenous languages some materials that, according to what the Institute for the National Peoples of Mexico has with their information, this
hemos en la página y con el trabajo de todo el equipo de la Subsecretaría de Prevención y Promoción de la Salud, de la Subsecretaría de Integración y Desarrollo del Sector Salud, el INSABI y múltiples secretarías de Estado, desarrollado diferentes lineamientos, tanto para personal de salud como para la ciudadanía en general, de cuidados en espacios públicos abiertos, espacios públicos cerrados, el lineamiento que acaba de presentar la doctora de la Torre, importantísimo para conocer toda la información.
Just gave us some very important information that shows there.
Hemos recibido apoyo, ofrecimiento.
Received support. We've received support from so many really important companies. So our chatbot that we launched yesterday, we developed this along with the Mexico Facebook team. And we've worked with information technology, worked with the Secretariat of Health, as well as different people who have helped us with our digital strategies and the president. Now, we launched Susanna Safe Distance yesterday, and we already have 12,000 users on this chat. One of the main questions that people have asked is, what do I need to do when I get?
Esa ha sido la principal pregunta que le han hecho a Susana a distancia a través de este chatbot, y eso nos da también luz para saber cómo vamos a ir modificando, cómo vamos a ir cambiando las preguntas de acuerdo a las interacciones que tengamos en el chatbot. Tenemos también ahorita un marco de perfil para nuestras páginas de Facebook con nuestros colores nacionales al fondo y un quédate en casa.
National colors, and we also have a Susanna Safe Distance stay at home. And this new way of sharing information with everyone is to help everyone be really well informed. Now, it's not just on Facebook, but also Google and YouTube. They are directly supporting us with what this normally costs. Google ads cost a lot of money. So do Facebook ads. We want to make sure that the users of these digital platforms are getting the information that they need. We don't want fake news in first place on the ranking for Google rankings. We want to be sure that in first place, Susanna Safe Distance, the chatbot comes up. Stay at home, stay at home, stay at home, stay at home. Our mobility reports have also been very important. Our scientific work group headed by CONACYT has been projecting how we're doing and what we think where we are estimating that we might be with the disease in the future. We use this information to make decisions and send out important information to the general public. Our COVID-19.mx app, we have more than 300 people who have downloaded this. And this is over 3 different platforms. We have Google Play, we have the App Store, and then we also have the App Gallery, which is for Huawei. So with these 3 apps, we're 100% covering everyone who has a smartphone to make sure that they can all download this app and have the information available right in the palm of their hand. Next slide, please. Here are some other examples of companies who have made an effort to get in touch with us. Taxis, for example, private transportation companies like Didi, Uber. They've gotten in touch with us to offer different services. For example, Didi started up a program called Didi Heroes. Health professionals can register with this program, and then you can support them so that they're driving to and from the hospital and make sure that they get home safely. Didi has also provided food coupons. Didi has also has put themselves forward as a volunteer to deliver food to health professionals as well. Now, I'm sorry to the other companies who right now are not in on this, but I want to say thank you so much to every company who has come forward, to the Secretariat of Health and to our Secretary, also specifically to me. I have to tell you, I really appreciate this. We've also had the health aggregate from the U.S. Embassy in Mexico. This is an important company, Walt Disney, major worldwide company, and they have said that they will put Susanna Safe Distance on all their channels. And for us, this is socially responsible. So the videos are they're at www.coronavirus.mx. You can find those on every channel, on all the channels that are nationally open. In terms of updating all of you, people from the media, it's important for you to understand that we have the Secretariat of Health information, and we will share that information with you. If anyone doesn't have that, please let us know, and we will tell you when there are updates. We also have the information, the Institute for Open Information. This is something that that society has really been asking us for. We want open information. How can we say, here's information that we can't share, here's information that we can? This is how we're going to be sharing an open information, open data website that all of you have been asking for. We know that civil society has been asking for that, and so has the media. And we also have anonymous information on there. This is where you'll be able to see whether people have COVID, how many people do. This is for all of the information that you've been asking for. This is INAI that's going to be sharing that information with us. They're going to help us create and build, not just with society's help, but also with the help from the society, from society in general, access to information. To sum up, the Telethon Foundation, they also announced formally on their websites and through the Federal Health Secretariat, as well as state secretariats, they have said that all of their power, all of their infrastructure, all of their information, they're going to share it. Now, these people are experts. These are experts in managing social media and talking with people and having contact with the general public. We're going to keep working with the Telethon Foundation. We're going to improve how we share information, especially sharing information with people with disabilities. And this is an extremely important ally for us in terms of how we're managing this pandemic. Thank you so much. Thank you, Dr. Alcala. Let's start with the Q&A period. You, and then Natalia. Good afternoon, Carlos Guzman. My first question is, wow, the governors, what a hot topic. The discordance, the dissonance that phase 3 had started or hadn't. Each person was making their own decisions. And then we heard about measures that might apply tomorrow. And then we learned about a hospital in Banamex, the Banamex hospital, which seems pretty well. But on the national context, how well synchronized, harmonized are the governors with what you are saying? Is there synchronicity? Are there problems with governors like the people in Jalisco, the governor of Jalisco, or the people in the western part of the country? My second question is, if you can confirm or not confirm the information that about 300 nurses from Cuba are going to be arriving to support our country with their experience in terms of pandemics. And then just talking about the subject that you just touched on, people with disabilities like HIV or AIDS, what is the strategy for these groups? Are they going to have trouble accessing their medication if they can't speak or hear? What are they going to do? What are people who are mute or deaf going to do? Are they going to have access to doctor's visits? I'm going to let Dr. Cortez answer that question. All of our health authorities have a same goal. We're all working for the health authorities, the Secretariat of Health in this case, and these people are heads of their states. Just that we have 30 governors and two other female governors. Everyone wants what's best for the population. We're all working together. You know, this is what the general health law dictates, and that's what we're doing. So we're collaborating, we have the same purpose, we're working together. It's not a competition. There's no problem in that sense. In terms of the proactive attitude of the state governors, I have to tell you that it's very favorable. Something that I want to highlight is that since there's a different intensity for transmission, as we saw yesterday on the map, since it's different for different states, in each state, we need to really have a registry of the exact actions that they're taking in each state. And that's going to be reported to the federal health authorities. Okay, people with disabilities, thank you. Thank you so much for that question. Yes, People with disabilities have a voice in this country. They are very important. They're very important for us, especially at our Subsecretariat of Health Prevention and Promotion. We are working directly right now on a guide. This is for taking care of people with disabilities' health under the framework of our COVID-19 pandemic. We're working with organizations from civil society, such as the movement 312. We're working with other groups as well. Then we're doing this so that we can launch the guide. Also through Teleton, I can tell you that that's going to be available for everyone with disabilities or without disabilities, everyone who wants support in terms of coronavirus information or how they're supposed to deal with this when they have disabilities, they can access that. Now, there are certain types of people, there are certain people with different types of disabilities, for example, lung problems, and we have specific information for those people. We have designated 2 specific centers that are going to be for pulmonary rehabilitation. One of those is the National Respiratory Institute, and the other one is the Teleton Foundation. Now, the experts from the Teleton Foundation are going to give telemedicine rehabilitation, telerehab. And we're going to have that on the page that we are also making accessible. So we're going to have really obvious examples, sometimes things that I don't even know, and other people have to tell me. Some people who have visual disabilities, they need us to upload the documents in a text format, like such as Word or Office, so that they can have their computer dictate that information to them. Thank you, Dr. Ricardo Cortez. HIV, yes, you're responsible for HIV. Thank you so much. That is a really important question. It's really important to get this message across. Number one, we need to guarantee continuity of treatment for people with HIV. Since over a month ago, we've had a page with specific guidelines and recommendations for people who live with HIV. As well as on our social networks, we have uploaded an email where people can contact us in case they have any questions or concerns, and that will go right to our people. They are reviewing all of those emails, and they'll be able to do outreach, if that's what's necessary, to other institutions, and also so that there's the right information. Now, this is for spokespeople and people from civil associations. These people are gathering information, and this information is aimed at people who live with HIV. I think sexual health is very important, and we really do have to be careful during this health emergency. We have 4 minutes left. Yes, 3 questions. Good evening, everyone. Hello, I'm from Diario Basta. My question is for you, doctor. How feasible is it that senior citizens are going to be using this application? You understand that in the contagion, these people don't have smartphones, or maybe if they do, they need help from somebody else so that they can access platforms. My second question is, what do you recommend cremating or some other way of disposing of bodies? Now, the purpose of having multiple platforms for communicating with people is this. Senior citizens who do use WhatsApp, well, they can use Susanna Safe Distance chatbot right on there. For people who only use computer with an internet connection, then they can do that at coronavirus.gov.mx. If I say, oh, okay, I'm going to download my application, I know how to use it, great. Like, for example, my father's 75 years old. and he uses internet. He has the application, and he told me. He told me he's already asked Susanna safe distance a couple of things. Natalia, and then we're done. In terms of biosecurity, the strategies such as cremation or inhumation, these are safe. It's important to think about where we are. There are places where it's going to be easier to do one type of body disposal, and other places where it's going to be easier to do it through inhumation. Now, of people who have been intubated, do you have the percentage of the people who have recovered? Now, the next thing is the open information. Are you talking about the confirmed cases? Where's the information? Nayarit and Veracruz. I think we do need to review that. I don't know if that's true, but if you have that evidence, please share it with me. That's not believable. How many people have recovered? I don't have the information, but we'll get it for you. It's few people. Probably because we have had relatively few people so far to count with those numbers. We've had few people who have had a significant impact of COVID and recovered. People who are sick from COVID, it takes quite a while to get over the virus. So people who have been in a critical state, it could be up to 2.5 weeks on average. So some people could be hospitalized for up to 2 months. And yes, we have had people who, in spite of being intubated for weeks in a critical stage, they still have managed to recover. And they've still gone back to a normal life. Can you tell us how many cases? Yes, I have it. I'll get you that exact information. Yes, from La Jornada, please. Last question. Good evening. I'd like to ask you if the mathematical models that you have talked so much to us about, if you can update the number of people who could contract COVID, the quantity of people who could die, for example. We'd like to know how many could die from complications. Thinking a little bit about what the doctor was presenting is where we're at right now. Are we seeing the results of the impacts of social distancing? Has it worked really well? Is it working sort of well? Well, Angeles, I want to again talk about people in general, and I'm going to keep saying this again and again. We cannot minimize this pandemic. It has been important at every single moment for Mexicans to know that we are facing a historically unprecedented pandemic that has a risk to our health that has not been seen in the whole world in 100 years. In 100 years. The last pandemic of this size, of this significance, it happened in 1918 and 19, and that was the Spanish flu. The 1918 Spanish flu from 1918 to 1919. Millions of people were sick and thousands died. Our pandemic has also behaved in the same way. It's been aggressive. We've seen it being aggressive in countries all over the world. It started in China. We've seen multiple European countries being attacked aggressively by this virus. And what is happening is that hospitals are oversaturated. The national health systems can't take all the people. And it has happened extremely quickly. This rapid propagation of so many more people sick every single day, of so many more people each day who need to be hospitalized, and unfortunately so many people who arrive in a critical state to the hospitals, and it's accelerating day by day. It's growing exponentially. It's very unusual. Now, we knew this from before the pandemic started in Mexico. We've known this. The behavior is something that we've been able to observe in other countries. In Mexico, the intensity of how this has been transmitted has been reduced, and that's very good news. And that's because of the massive mitigation measures. Suspending work except for essential workers, closing down schools, and prohibiting people getting together in large numbers, in public or private. We can't have any weddings, baptisms, we can't have people congregating, because this harms us all. This just makes contagion spread faster. When we think about the most unfortunate event of this is people dying, well, in proportion to the number of cases, well, probably the number of people who die are going to increase. That's normal. Now, so far, it's been pretty relative. That percentage of 5 to 6 or up to 7% of people who together, along with all the sick people, they die. But if we specifically see it, people who are critically ill, for example, people who have lung problems, who get to the hospital and they need therapy, they need intensive care, they need ventilators, they need mechanical breathers, the famous intubation, the mortality rate for them in this critical state, that could end up being 70 or 80% of people. So people who are critically ill, 8 of every 10 could die while they're hospitalized, in spite of the fact that they do receive treatment and medical support. Let's not forget that up to now, there is no specific treatment that is going to repair the lung damage, the accelerated lung damage from coronavirus, COVID-19. So we've seen that even when the comparison between people who arrive at the hospital are not in critical condition and the people who are in critical condition, we've seen that taking these measures that I talked about is important to be able to have the body be able to heal itself and go forward. So if we did have an excess number of cases that were saturating our national health system, and that was in proportion, we're going to have a significant number of people who are going to die. And that is also going to overtake our systems, for example, for funerals, which are for the majority private systems. I am going to end there. We have half a minute left. Now, this guide, we need to be very realistic about it. We need to be realistic about the scenarios that we're facing. We have to be prepared in every single aspect. We've been working on this for weeks. We presented it a couple of weeks ago. We presented what corresponded to phase 1 and phase 2, and now we're going to have it on for phase 3. Thank you so much. We will continue to be updating you as things develop. We'll be letting you know about our progress and let you know which measures are helping us, and we will be updating our database. Thank you.